Xavier Becerra.
The Biden administration has been working to bring financial relief for the over 65 million Americans on Medicare and pushing drug companies to lower the costs. Americans are reaping the benefits, like the law that has capped the cost of insulin for Medicare to $35. And I'm excited to have the Health and Human Services Secretary on with me, Mr. Xavier Becerra, to talk about what is coming down the line, some exciting news. Welcome to American Urban Radio Network.
Ebony, thank you for having me, and I'm glad you're using the word excited, because that's what we use as well, because it is game-changing how under President Biden we're actually lowering the cost of medicine and we're making it available to even more people. And so today we have more Americans with health insurance coverage, which means, by the way, a lot more Black and brown folks have gotten health insurance under President Biden than under any other president. And we're actually lowering the cost. And as you mentioned, $35 for a month's supply of insulin when people were paying 3, 4, 5 times that amount just a year ago.
You said on your Twitter page, you made a post, and it's something that many of us say all the time, but until you go through it in real time, you don't always understand the impacts. And you posted, no one should have to choose between feeding their family and taking their medicine. And I know that I have family members, with people in my family, that have had to make that decision. And I've come into contact with other people, millions of people, who have to make that decision every day. So let's talk about specifically what is happening with these 10 drugs that are now being negotiated.
So yesterday, February 1st, by the way, happy Black History Month. Yesterday, we began the historic process of negotiating to reduce the price of the most expensive medicines that people use. And it sounds like a no-brainer, but believe it or not, up until this year, it was against the law for our federal government to try to get the best price for the 65 million people who are on Medicare when it comes to their drugs. Incredible, because you see how we pay 2, 3, 4 times more for a same drug here in the US than in other countries. It's because we have to accept the price that the drug manufacturer wants to charge us. It's like saying you're going to walk into a car dealership to buy a new car. Who walks into a dealership and says, I saw the sticker price, I'm ready to cut the check for the sticker price? Everybody tries to negotiate it down. Your sister went in, she negotiated it down. You heard that. You read Consumer Reports. You know the price is less. Why would you walk in and pay sticker price for a brand new car? Some of these medicines cost more than a brand new car. Why would we let drug manufacturers charge us a sticker price for those medicines?
It almost feels like, Secretary, you're being robbed. And you actually are, and legally robbed at one point, and you couldn't do anything about it. And the sad thing is the fallout, from talking with a lot of people, is that when you are not able to afford these medicines, you do what you feel will help alleviate and eliminate the pain. And many times that is using illicit drugs, because you can't afford the medicine that you need that will help get you to a healthier place.
Now, you use the word rob. Let me tell you what not the administration's estimators, but the estimators from Congress said that as a result of negotiating for better prices, we will save about $100 billion just on these 10 drugs over the next 10 years. That's how much, in your words, we're being robbed in money. That's money out of the pocket of good Americans and going into the pockets of these drug manufacturers.
Can you name some of the drugs that we're talking about here?
There's 10 of them, and how about I do this, because most people won't recognize the name except of a few, but they are for diabetes, for stroke, for heart disease, cancer, kidney disease. They are the chronic conditions that so many Americans suffer from. By the way, in the Black and brown community, again,
I was going to say that.
Yeah, big. And so it's no surprise that some of the biggest savers as a result of lower prices negotiated by the federal government under Medicare, Black and brown communities will be some of the biggest winners in this.
So those who are going to be watching this and they're like, this is amazing news, especially those who are on diabetes medicines and cancer and fighting heart disease, and they're like, okay, what should I be expecting? What is the timeline for this?
So yesterday, we submitted to the manufacturers of those 10 drugs our price, what we consider to be a fair price for their drug. They now have essentially 30 days, if they wish, to counter our offer. And if they do counter, we'll go back and forth for a while. But by August 1st, we must conclude by law the negotiations. And by September, we will announce what those prices are.
Absolutely.
By
Um,
the way, Ebony, I should mention, September we announce what the prices are, but because you have to let the system, the health system, absorb the new prices, whether it's the Medicare program, whether it's the insurers, whether it's the providers and doctors and hospitals, they actually won't take effect until January 2026. I want to make sure that's clear because someone's hearing this and saying, aha, come August, new better prices. The prices
right.
will be announced, but folks won't see them take effect until January 2026 because they got to get absorbed into the system.
What about those really quickly before we go? What about those who are on Medicaid? Can they be expecting anything to happen on their behalf?
The reality is that under Medicaid, we get better pricing than we do under Medicare because we're able to get a better rebated price. But my sense is that if we're able to do and through drug negotiations, what we've seen done to try to help keep the prices competitive for insulin and other drugs, that it won't go just to Medicare recipients, but to folks in Medicaid and in private insurance, the savings. Because once you see what the real price could be, why would you pay a different price? Why would you let someone charge you more? And so there will be pressure on the manufacturers, and there will be more competition to give you a better price. And so this is the beginning. Every year, there are only 10 drugs we're negotiating this year. Come next year, another 15 will be negotiated. Come the year after that, another 15, and on and on. So we're going to be adding more drugs to the list of negotiated drugs. The savings will continue to accrue to each and every one of us who has to use them.
Mr. Secretary, as we go, where can people go to find out more information about what savings could be coming their way? And I will also point out on your website, there's an amazing map people should check out to see state by state the savings that is being done.
So if you just log on to the Health and Human Services website, hhs.gov, we have any number of sites that'll give you information, not just on prescription drug negotiations. We just announced in the last day that we're going to start doing a cell and gene therapy model program on sickle cell disease, where we think there may be an actual cure, and it's going to be a program that'll help make it more affordable because that sickle cell disease therapy that's now been discovered is going to cost around, we're told, between $2 and $3 million
I
per
saw that
person.
report. I almost fell out.
Yeah, we're
Thanks,
trying.
but no thanks, right?
Yeah, well, see, that's why there are about 100,000 Americans, mostly Black Americans, who are suffering from sickle cell disease. We know most of those folks won't be able to afford that kind of money. And so what we're trying to do is see how we can lower the price. So what we're telling the states is through Medicaid, because about 60% of those with sickle cell disease are on Medicaid, let's work together. The federal government can pool the states together, and we will leverage every one of the states' population with sickle cell disease, and we'll try to bargain for the best price so we can lower the price of that therapy. And hopefully that way people will have access to it faster, even if they're not wealthy.
Well, thank you so much for sharing that. I would love to have you come on and talk about that. We've done a lot of reports on sickle cell on this network, but Mr. Secretary, Mr. Becerra, thank you so much. And we look forward to having you back on American Urban Radio Network.
Ebony, you have to have me back because then we'll talk not just about that, but we'll talk about how the greatest increase in the number of people signing up for Obamacare has been in the Black and brown community. And that's why we're breaking records, and how much we're saving people, about $800 a year because of the subsidy. I got to come back because there's just too much good news.
Well, on that note, happy Black History Month, sir.
Amen. Amen.
All right. Thank you very much.
Thank you.